So how does PRESBYOND blended laser vision work? Well, what we do is, as always, begin with the patient, their lifestyle and their eyes, and we not only look at the prescription, the spectacle prescription, which we always do with any kind of laser eye surgery, but also we look at an imperfection in their optical system called spherical aberration. And the reason we want to measure that before we touch them, before we touch the patient's eyes, is because we are going to use that imperfection. Now, to a lot of eye surgeons and optometrists and people who work in the optical profession, it feels quite wrong to talk about an imperfection in this way. We have been conditioned, I think, a lot by the industry, by lens manufacturers and optical machine manufacturers, to be on a quest for perfect optics. And it makes sense that we want to always be creating a perfectly sharp image for our patients. And if we were looking after someone who's 21 years old, 25 years old, and they've got their wonderful full accommodation, their ability to shift focus, absolutely, we can go for completely crisp, sharp, focused optics, all crisply in focus at distance, and the patient will then do the hard yards. They'll move the image for us backwards and forwards, focus in on their thumbnail at this distance and back out again. But as soon as we're looking after someone who's over the age of 40, we've lost some of that ability. And as soon as we're looking after someone who's over the age of 50, we've lost a lot of that ability. So that if we create perfect, sharp optics for that patient out in the distance, they'll be on and off for the readers all the time, because they can't bring the focus in. They just can't bring it in. So we want to create deliberately a small amount of imperfection. And we use spherical aberration because our brains are used to it. It's an imperfection which forms part of accommodation. So we know how to tune it. We can accept a little bit of spherical aberration. Our brains will sharpen it up and give us a nice crisp image. What that then allows us to do is to increase the depth of focus on each eye. And if all we did was increase the spherical aberration and the depth of focus on both eyes for distance, we'd have done a pretty good job actually for a patient who was 50. We would make their intermediate vision quite good. They'd be able to see what they're eating without specs, which maybe doesn't sound like a big deal, but if we've created perfect, crisp, sharp distance vision, no, they can't. It's readers on and off just to see their food. If we then make one eye just slightly short-sighted, in combination with that increased depth of focus, the two eyes are overlapping to a significant extent, so the intermediate vision, both eyes are bringing some vision to the party, but the short-sighted eye, the one we've brought in a little bit, can boost that near vision significantly, so that now we have a person who can read, who can see the time on their watch, send text on their phone, look at that menu, and they're not just saying, I'll have the fish, because they've got no idea what it was on the menu, or reading the specials board on the other side of the restaurant. They're actually reading the menu and they're making a considered choice based on what they feel like, having read all the choices. So we can achieve that range of focus by deliberately creating a small controlled amount of imperfection, spherical aberration, on each eye to create a range of focus. And it's still a good level of vision, it really is. These patients have 20/20 vision. They're getting N6, N5, which is a good level of small near vision, and excellent intermediate vision, which is so much of life on the computer, dashboard in the car. So it's an incredibly powerful tool to give people a great range of focus in their 50s, when many patients still have a very clear lens inside their eyes, so they don't have any sign of cataract. But also these patients are future-proofed. So let's fast forward them. Let's take them forward to their 70th birthday, and let's say they now have some significant cataract, so the quality of vision is not so good, they've lost some sharpness of vision. They could have completely simple but elegant cataract surgery with a neutral lens that just gets rid of the cloudiness and restores the quality, and the PRESBYOND blended vision will be reanimated. It'll all just work again. they've been doing it for 20 years and they can just carry on doing it. Let's fast forward 20 years and imagine I'm not using the technology that I'm using now, because it's likely to have moved forward. So let's say Google or Apple or one of the big tech giants has created a perfect human replacement lens that accommodates, that flexes like our lenses do when we're in our 20s. My patient can have that, and the PRESBYOND blended vision curvature on the cornea will not compromise that in any way, shape or form. And in fact, you'd probably just get rid of the difference in the eyes at that stage and set both eyes up for distance, and then it really would be like being 21 years old again with a lens that flexed. So I find that a very attractive feature of PRESBYOND blended vision for patients who have no sign of cataract and the right prescription, a good tear film. It's a lovely option for now. It provides great function now, but I know I've future-proofed them. I know that when I've retired, I've set them up so that they can, with a variety of different approaches, carry on enjoying great vision even if they need cataract surgery later in life.